Good afternoon. I am Stephen Bowman for the next 10 minutes. I'd like to fill in for Stephen. Unfortunately, he was in an accident and is unable to make it, but we believe he'll be okay. What I'm going to do with the Joint Commission presentation is give you a little information about who the Joint Commission on Healthcare is, what they do, their involvement in vetting legislation across the Commonwealth of Virginia associated with health policy, and sort of a lead-in, which is then going to go on to the second portion of what I'll be talking about, which is a little bit about VHI and our involvement with the APCD. So, as you can see, Steve had said that he was going to be trying to answer those questions. Since he's not here, I don't have to, but I'll give my best to do that. But I want to give you a little background on the Joint Commission. Start with it. 10 members of the House of Delegates, 8 from the Senate, Secretary of Health and Human Resources. They make recommendations on health care provision, looking towards ensuring that care is both safe and cost-effective and is available for the greatest number of Virginians. Through those efforts, they've actually sponsored a number of organizations, startups, including the Virginia Healthcare Foundation and Virginia Health Information for 2 of those over the years in an effort to try to improve the lot of people with health care in Virginia. You will see from here some background information on inflation and Virginia's healthcare sectors associated with these. Eileen, will they have access to all this information later on at a later date? Okay, so I'm not going to go through and read all of this, but some of the highlights are that there's a lot of variation in care. There's opportunity for improvement. We're actually getting very, very good care, but our stakeholders and others continue to strive to improve it. One of the sections is the right care being provided? And said that there's a lot of regions difference in the prices as well as the rates of different care by regions, by cities, by counties. They're driven by a number of factors. Stephen then goes into information on the publicly available information from that. You're probably familiar with the concept of Medicare, which is essentially a program in general for people 65 years of age and older, Medicaid for low-income children, pregnant, hospital discharge data is additional information. The BRFSS, anyone familiar with that? I didn't think it's really a public health tool that is used across the nation actually for trying to understand the health of a population. It can come into play when you're looking at different things to intervene on, different programs, different policies and procedures. So, he goes into a little more detail about the claims about healthcare delivery in the primary care setting, that you can compile an APCD, and I'm going to get into this a little bit more in a few moments, but essentially takes information from all different sources and puts it together, anything associated with a claim through a healthcare encounter. Through that information, you can look at things associated with healthcare expenditure patterns, look at the local area population health, and look at the variation of that, and start to teasing out information. I'm not going to he's got some information on the information that we have. I'm going to get to that in a little bit, but essentially we do have inpatient information, some outpatient information. The unavailable information, things that will be available with exclusion of dental information is on the unavailable side through the APCD. So again, Stephen makes a point that we can't look across the entire care continuum because we have pieces. Now, we can argue the fact that the hospital information is a very important piece. Certainly, this is where the most serious care comes, a lot of expenditures are, but it's not all. It's not pharmacy, it's not all the different, more and more surgeries being taken place on an outpatient basis, both in hospital facilities, as well as freestanding ambulatory surgical centers and even physician offices. So there are gaps in this. So, little history, and actually the history goes back a little further, but essentially there was a bill that was approved for introduction by the Joint Commission on Healthcare last year. There were several things that they wanted to create a Virginia APCD. It would be housed at VHI under contract with the Department of Health. There's a national emerging standards associated with submission of this information. It's called X12 PACTOR. Insurers would be mandated to provide health care claims. It was introduced into both the Senate and the House, And essentially, there was a lot of effort associated, a lot of dialogue that went on between all the different parties and players. And essentially what came out of this was a voluntary bill